In this video, I'll be going over the different types of tools and instruments used for extractions. This first picture is going to be our extraction kit. We have the Explorer, our cotton pliers, our syringe, Minnesota, small, medium, and large elevators, our root tip pick, our curette, periosteal, blade holder, and then up top we have the surgical hemostats and the surgical scissors. This instrument is called a Minnesota, and it is used to retract tissue, the cheeks, or the tongue. The next three instruments are the small elevator, the medium elevator, and the large elevator. All three of those elevators are used to loosen the tooth from the periodontal ligaments before the extraction. The next instrument is called a root tip pick, and it is used to lift and remove small root tips in difficult areas. Next is a curette, and it is used to remove or clean any excess blood or infected tissue from the extraction site. This instrument is called a periosteal. It's used to lift and reflect the thin layer of tissue that covers the bone. The next instrument is a blade holder, and it holds the 12 or 15 blade for cutting tissue. Next, we have the surgical handpiece and the surgical crosscut burr. These are used when doing a surgical extraction and the tooth needs to be sectioned. This is the luxator, and it is used to rock the tooth back and forth before extracting. Now we have the root tip elevators, and those are used to lift and remove fragments of the roots. Next we have the east and west flag elevators. Those are used to loosen, separate, and lift roots from the socket. Next we have the root tip forceps, and these are used for retrieving root fragments on either the upper or the lower arch. These are the rongeurs, and they are used to trim and remove excess bone after extracting teeth. Next we have the ligajet, and it is used to inject anesthetic under a high pressure when the patient is having a hard time getting numb. Our first forceps is going to be the 151, and this is used for lower anteriors, premolars, and molars. The next forceps is going to be the 150 forceps, and this is used for all upper anteriors, premolars, and molars. Next, we have the cowhorn forceps, and this is used for lower first and second molars. And finally, we have the birdbeak forceps, and these are used for lower premolars and anterior teeth.